If you or your child struggle with anxiety, ADHD, or emotion dysregulation, there's actually a therapy that helps retrain the brain to be better regulated without medication. I'm Dr. Andrew Lima. I'm a licensed clinical psychologist, and I specialize in advanced brain-based therapies such as qEEG brain mapping, neurofeedback, and technological treatments such as virtual reality exposure therapy. I like to use technological treatments to help people who have failed traditional therapies. Neurofeedback is a way to train the brain to better self-regulate. We use non-invasive sensors on the scalp that read brainwave activity in real time. Software then feeds back their brainwave activity to the individual, which allows them to learn how to self-regulate it. See, we normally have no awareness of our brainwave activity. If I told you right now to shift your alpha brainwave activity up, you would have no ability to do that, even if you knew everything there was to know about brainwaves. We just don't have conscious control over every little thing in the autonomic nervous system. That's what biofeedback, and specifically neurofeedback, helps with. It feeds back activity that we have no conscious awareness of, which gives you the ability to manipulate it. By doing this over and over, we allow the brain to learn to better self-regulate, and through the power of neuroplasticity, the brain will start to form new pathways that are long-lasting. So what that feedback actually looks like is what we use here at Center for Cognitive Growth are shows and movies that the person gets to pick. So for example, a child with difficulty focusing who has, say, too much fast brainwave activity on their brain map will come in, sit down in our chair, have sensors attached to the scalp, nothing's going in, it's not shock therapy, it's just reading what's already there. And they get to pick their favorite show on Netflix or YouTube or Disney+, so that way they're engaged with the process and are gonna be motivated to sit there for a while. The show will then feed back the activity in the form of brightness. So the show will play nice and bright when their brainwaves are showing the right thing and when they're focused and in the zone, and will dim out as soon as they're not showing the right activity. This is known as operant conditioning. You get rewards for doing the right things and punishments for doing the wrong things. This allows the brain very rapidly to learn how to stay in an optimal state. And again, by capitalizing on neuroplasticity, the brain will stay in that state for longer. Before doing any neurofeedback therapy, we always do a qEEG brain map and cognitive testing so that we know exactly what's going on in the person's brain and we can personalize our treatment plan to them. Generally, we're gonna have one of three patterns. We're gonna have an over-aroused brain, which is gonna show too much fast brainwave content, an under-aroused brain, which is gonna show too much slow brainwave content, or a mixed arousal brain map, where they're gonna have too much fast brainwave content and too much slow brainwave content. Once we know exactly what we're dealing with, we can personalize the treatment plan to that brain. The disorders that we see this helping most with are ADHD, anxiety, depression, learning disabilities, emotion dysregulation, autism spectrum disorders, traumatic brain injury and concussion, brain fog, chronic pain, and chronic stress. There's also a whole application of neurofeedback therapy targeted to peak performers, so individuals who don't have a clinical diagnosis but just want to train their brain to be at its best. Now, the reason why me as a licensed psychologist has transitioned my practice to doing almost exclusively neurofeedback therapy is because day in and day out, I see enormous progress in my patients through retraining the brain to be better regulated. We make progress much quicker than people make in talk therapy and with medications, and we can really get at the heart of the problem much quicker. So for example, if a 5-year-old child comes into my office having just been diagnosed with hyperactive type ADHD, there's really no talk therapy, one-on-one talk therapy that's going to benefit the child dramatically. Now, I'm not saying that talk therapy isn't helpful. It is helpful to work with the schools and work with the parents on a plan to managing the child's environment so they can be at their best. However, we actually want to retrain the brain to not be as hyperactive and to be able to focus and be more sharp. There's no talk therapy that's going to do that. And if the parents don't want the kid on medication, or if the child doesn't respond well to medication, they're really left with no options, unfortunately. Neurofeedback is life-changing for these cases. I love it because we don't have to really talk about the problem. A lot of kids don't want to talk, and we can really make changes quite quickly. So if you want a deeper dive into neurofeedback and brain mapping and want to find out more about how it can benefit you or your child, click the link in the bio below and reach out to me directly. Don't forget to like, follow, and subscribe for more content like this.